All right, hello, I'm Bill Baxter. I'm very happy to have all of you here today because this, to me, is a very concerning issue. Is this working? There we go. So first thing I need to understand is how many here are familiar with My NCBI? Do all of you log into that and use that? Show of hands again, please. It's probably half the room. I'm not going to be able to go into detail about how to use My NCBI. However, at the end of this presentation, I've supplied an appendix with links to YouTube videos and other ways that you can learn how to use My NCBI to manage your manuscripts and manage your My Bibliography. This is something the NIH is mandating, and we have to go along with it. Okay. It's working? A portion of this presentation I was able to borrow from a recent presentation that I attended online that was given by the NIH, and it was on June 26th. I'd like to give some acknowledgments to them because I have taken some of their slides and used them. What I'd like to talk about today is the current situation, what we have with our NIH funding, the different policies that we have in place with NIH and OSU. There's open access policies that we have to comply with. I would like to talk about the awardees' responsibilities and what you need to do to keep your funding flowing. I'd like to give an overview of the NIHMS system and how data travels and how that is linked in with My NCBI and compliance management, and how that links back to ERA, which is the key to unlocking your funding. And then I would like to talk about how we can ensure compliance. So the current situation right now with NIH funding, and thank you, Christiana, these are all direct costs. This is 2012, 2013, 2014. Unfortunately, we're seeing it going down because the government's limiting our funding, but the number of types of grants that we have has come down. Yet the number of grants that we have is 17 this year that are coming up for renewals. And all of those renewals will have to use our PPR reporting tool for publications. And some of them will also have additional stipulations that are added that the NIH is doing on an RFA specific test, I guess is what they're going to call it. There's a new BioSketch format coming out that they would like us to start using, but that's going to be RFA specific. So anyone that is submitting an application, proposal, or report to the NIH must include the PMC reference number. That's part of meeting compliance. You have to cite it. I am not going to show you the appropriate ways of citing it, yet that's found in the appendix. Funding information must be included in the publication, and it must be the number. If you're using the EHSC, you don't say the EHSC or the Environmental Health Sciences Center. You need to have the grant number listed also. The PI is ultimately responsible for compliance with the policy. You'll see later that the publisher might submit publications for you, but it is the PI's responsibility to make sure that this gets done. And you're also responsible for ensuring that it is done within 3 months of publications. So I want to stress that, and you'll see it later on in the slides, but funding is being withheld or potentially can be withheld by a publisher depositing the manuscript for you in PMC, waiting for their embargo period, which currently is 12 months, and not submitting it to PubMed Central for 12 months. You are automatically out of compliance. You will fail my award list. It will show as non-compliant. Most of this will make sense as we go through this slide, and I give you an overview of how this is all tied together. So the NIH compliance policy was actually put into effect on April 7, 2008. So we have this backlog of 6 years of publications that we will need to bring into compliance. They actually put the teeth, the mandatory withholding of funds policy was our Valentine's present last year. They actually, it does no use to have a law that says you can't go over 75 miles an hour but not issue any tickets. So the other thing with that is that OSU also has an open access policy based on the NIH's access policy. NSF and USDA are developing similar compliance regulations. So what we see today will also start affecting NSF and USDA grants. and there is no institutional monitoring for any of this. That's concerning me greatly because this is a large issue. We've got a lot of money at stake. I personally feel there needs to be some institutional monitoring that goes on. There needs to be a compliance office, which they are setting up, but it still is maybe a year out before we actually will see anything that is usable from this position being filled. So award number one that we're going to talk about was in the year four of 5 years of funding. It was about $215,000 of direct costs, and it was withheld because a couple or a few pubs were not compliant. We have seen another one that was acknowledged only days before the funds needed to be dispersed, and that was for almost $500K of direct costs, which really would have put a crimp in things if we didn't have the money in the bank the day we needed to start dispersing it, as well as we weren't able to pay salaries, equipment, et cetera. It could cause a lot of problems. We've also seen that we've excluded about 100 plus pubs from proposals and progress reports in an attempt to meet NIH compliance or circumvent, as I have listed here. And what we find out is that doesn't work. The data is stored in a database. They query the database. It's got your name on it, and they just come back to you and say, oh, this doesn't work. So let's not try that. The policy is mandatory. It is the law. But making published research funded by NIH publicly available is an important opportunity to advance science and improve human health. So we need to know what to submit. It tells us everything here. We need to submit a final peer-reviewed manuscript. We need to know when, upon acceptance for publication. When to make it public, no later than 12 months.
So why doesn't the 12-month embargo?
This is the same thing. This was written into the policy to force publishers that will publish manuscripts in their journals to comply with the NIH policy, and they would give them a 12-month embargo so that the publisher could still generate revenue.
But now it has to be there within 3 months.
We have to apply into the NIHMS system. That's the National Institute of Health manuscript system. We have to make that submission and have it completed within 3 months of publication. However, it won't be released for the public's view for 9 more months or for a total of 12 months. Yes?
Several journals now have multiple publication dates.
EPUBs and so on, yeah.
Applies to this policy.
It actually is very convoluted. It depends on the journal. And different publishers have multiple copyright regulations depending on the publication. I'll show you later on some resources where you can go and look up specific journals. And it is the PI's responsibility and also the author's responsibility to ensure that their publications are with a journal that allows them to post NIH. Some journals have stated no problem. There are still a handful of journals out there that will not allow you ever to put texts out. You have to pay to see it from that publisher. And that is in violation of the NIH agreement.
What do we do then in that situation? In detail, where we're not even allowed to take an NIH-supported publication. Central.
That's something that lawyers are going to have to, there's got to be some discussions with that.
Being not compliant because you
right.
in a journal, then we just stop money. I mean, I don't understand. There's got to be a.
That's a conversation I think you'll have to have with the NIH. They've been fairly lenient with us in some ways, like they're allowing us to mass upload some data, and they appear to be very helpful. I have no idea.
Well, do we know which journals those are that we could
avoid them?
Yeah,
avoid them? I could try and put something together for you.
Yeah, it'd be good to know.
Yeah. Let's deal with that when we get to the slides about the copyright. Yes. What to submit, when to submit, when to make public, and where to make it public. It must be PubMed Central. So This applies to any manuscript. I'm going to go through some of these fast in the interest of time. I apologize. It's peer-reviewed. It happened after the date, and it arises from any direct funding from an NIH grant. And I need to point out this. Directly funded means costs that can be identified specifically to a particular sponsored project, or that they can be directly assigned to such activities relative easily with a high degree of accuracy. This should have quote marks out of it around the whole thing. This is something directly from the NIH. This goes back to a law that they enacted in 2003. And this means that if a piece of equipment was paid for by the NIH and it's now being used, it needs to be cited. And there's been a lot of talk on the NIH forum about this. I don't have any answers, so I'll continue, but please be aware of that. So the non-competing continuation awards, this is for the 17 awards that we saw earlier on the slide. We'll have to file a progress report this year. Some of them already have, but those that still have to apply need to follow this process. Your award will be placed on hold if it doesn't meet compliance. And you're required to use My NCBI to report all your publications. You are forced to use their tool. And you're forced to use their tool to generate the RPPR forms. Now, it's easier for you in some ways because you don't have to manage these tables anymore that you used to have to submit, these Excel and Word files that you went through and you tried to get everything formatted correctly and highlighted. That's being done for you. But you have to get it in the database correctly the first time around. And if you're familiar with the PHS 2590 form, which is the publication form, as we just talked about, it's replacing that also. So OSU also has an open access policy. And I don't want to go into this in detail. Michael was unable to make it. However, I really want to thank Michael for working with us on this. And he's created we have created a process together that simplifies the submission at OSU for publications. Hopefully we can make this easier for all of us. And we are the first university, public or private, in the Pacific Northwest to adopt this policy, and one of the first land-grant universities to do it. So we're trying to stay ahead of the curve with things. One of the situations that we need to be ahead of the curve on, and I can't stress enough in this meeting, talk to your department heads, talk up the chain to get some compliance monitoring done at a high level. And based on those changes, Oregon State University, they approved that. And it's basically following the same as the NIH. You must submit a peer-reviewed journal at the same time to scholarly archives at OSU. First of all, I want to make the distinction between PubMed versus PubMed Central. People hear those two, they think they're the same, but they're not. This is a good way of looking at it. Oh, PubMed is like TV Guide, or now most of us have digital televisions. The little menu that comes up and says, oh, at this point, this happened, and here's a little abstract of it. That's all you get. PubMed Central is like PBS, where you can look at the abstract and then you can go online and download the podcast, open access to all the information. They are separate. We need to also define document types between final published articles and final peer-reviewed manuscripts. There are 4 different methods for submission. We'll get into that later. This is extremely convoluted. I apologize. But any PDF that you get from a publisher is copyrighted material. Some journals allow that to be submitted directly. PubMed Central still requires, in most cases, the peer-reviewed journal to be submitted at the same time so they can make their own XML PDF generated copy that they store in their database. They would like both submitted if possible. Final peer-reviewed manuscripts, of course, that's method C and D. Trying to figure out what method is what can be confusing. This slide we will come to a few times, and it shows the linkages. So any submitted files in any format from a publisher or from a submitter or from an author come into the NIHMS system. They're uploaded in PubMed Central. At that same time, they're also linked to PubMed. Now we have a lot of things that are already in PubMed, and we're trying to link them back. This arrow should actually be both directions. And the full text XML and the final article PDF, this is something that has been done by NIHMS and submitted to PubMed Central. As you see, all of that comes back to My NCBI and My Bibliography. That is the gateway to get to ERA for your progress reports, for your proposals, to get those dollars to flow down and get them to you. It's the only mechanism at this time to supply ERA with accurate data is through My NCBI. So what happens for the awardees? We need to address copyrights. We need to learn how to post publications. Then we need some type of compliance management. So the authors own the original copyright material they write. And I have a few paragraphs. I'm going to shorten this up. But the institution and the investigators responsible for that make sure that the copyright transfer agreement allows you to submit it to NIH. We encourage authors to consider who will submit the paper, who approves the submission, what version of the paper will be made available on PubMed Central. You can opt for an open access status of your publication, I guess would be the term we would use, and you pay for that. And I've seen them as low as $500 or $800, and I've seen them as high as $10,000 or $12,000 per publication. Some universities are actually just paying that up front. Others are doing everything on open access journals. What will be submitted? There could be a cover sheet that has our copyright information from the university, or there might not. That's something we'll look at later. This is the simple step of how to post your publications. You're submitted and the author approves it through the NIHMS system. No matter who submits it, publisher, yourself, or a delegate, the author has to approve that publication. That's the pre-processed version that NIH does. Those familiar with this, you've seen this peer-reviewed manuscript, all your supplemental text, figures, that all gets compiled into something that they call a PubMed Central version. That's this document conversion. Then the author has to approve it, not a delegate. The author has to approve it, and then it's finally put on PubMed Central.
So real quick, define what's meant by author.
One, a person that is listed as an author on the publication.
So yeah, so the other coordination is, number of co-authored, in this case, the SRP, and we have to get our ducks in a row. Kim doesn't do one, and I same thing, and then all this, they're colliding. So who gets triggered? Who gets triggered? I mean, if Kim has, it's not just the corresponding author. It's Kim as.
Well, let me show you that from the NIH. I have a screenshot of that, and that might clarify that. So there's 4 ways a paper can make it into PubMed Central. A, publisher that participates in this can publish it directly to PubMed Central. You generally pay for that. Method B is you arrange to have the publisher do it. When you submit that in your cover sheet, you say, please make this available to PubMed Central. They will make it available. However, it is still up to the awardee to ensure that it is done within that 90-day window. We have had instances where the publishers don't do it. Yeah, Robert, you know firsthand. So method C is you or a delegate put the manuscript in. And D is the publisher puts it in, you still have to manage it. I'm not quite sure what the difference is between B and D. However, I don't have time to go through it at this point.
So one thing, I know we can't upload like the PDF from that
the publisher,
journal, right?
Correct.
But our final electronic version of the manuscript may not be the exact same.
Right.
And because we see page proofs and we may
Correct.
change page proofs. So what about that?
You don't get that. That's owned by the publisher.
So
it's copyrighted by the publisher.
Posted.
Okay. The one that may be slightly different than the actual final.
Yeah.
All right.
And I'm sorry, don't shoot the messenger.
No,
I'm just trying to understand it. All right.
So Sherpa Romero, as I was mentioning some of the useful resources, use this link. Check out your journals. It talks about what you have for embargoes, what you have with copyrights, what you can publish online, when you can publish it, what you can do with post-peer-reviewed, what you can do with peer pre-reviewed. Basically, it outlines it. I don't have a screenshot of it, but I would.
Bill, do you know what happens? Say, so if you just defaultly select 12 months, right? And the journal doesn't actually let you do that. Say it's 5 years. When do they figure that out?
At the NIHMS system.
So
They're pretty thorough, yeah.
Okay.
I've got a funny slide we can show you that actually from the NIH that they didn't catch one of their own.
So that resource is actually in the UK?
This particular one is an open source group that said, hey, we're trying to become compliant. We don't know what's going on with journals. So they created a database and a web service attached to it in order to allow authors to have a place to figure this mess out. I commend them for doing it.
The UK doesn't have any, or the EU doesn't have similar requirements in their funding agencies?
Oh, no,
So what I'm wondering is, it's for the NIH.
It's a good point, Dave.
And they're a UK resource. I just wondered why that, maybe they just found a way to make some money on it.
NIH should compile it.
I have no idea. And I haven't seen any banner ads show up on the website either. So I don't know why they're doing it as a service for authors. And I appreciate what they've done and I use it on a regular basis. So let's go fast here and we're going to blow through some of these things. So the A and B, the journal's deposited. B, the publisher deposits it. It gets into PubMed Central. You still have to answer that email that comes in. You still have to log into My NCBI, and you still have to approve those manuscripts, any of these ways. Then we have the longer process, C and D, where an author or a delegate submits a final peer-reviewed manuscript. And we're going to talk a little bit more about the delegate in a little while. And with method C and D, the author still has to approve that PDF file, as you saw on that one slide. That final peer-reviewed, once that's submitted to NIHMS with all the supplemental information, they send you that and they say, go online and approve this.
How do we change that?
I can show you that. I have a slide for that. And then again, you have another author approval after it has gone through NIHMS and done all the cranking and created their version. You then have a new approval that you have to do. The neat thing is that OSU Library, the Center for Digital Scholarship and Services, with our process, will take over at this point. So when you submit a manuscript, you can also submit it and email it directly to the library. They will deal with the NIHMS and these next screens that you see on how to submit a manuscript and that you can totally ignore. They will take care of this for us.
Do they have the capacity built?
Yes. They've been staffing up for that. And I just got word from Michael Bach yesterday that they want to link directly into the GAP system. And they want to continue developing a web form. And they want to make the submission process easier. And they also want to help us store other pieces of data. They've been a very good resource, and they've been very. So as I just talked about, this is just hashing it out again, that they will reduce your workload. They'll take that away from you. You'll still have to go in and authorize those publications at 2 different places, but this is a lot easier than doing it all yourself. And this is a link to how you submit that.
And Bill, one other question.
Yes.
We have our PNNL folks who may be the primary authors. We may or may not from OSU be authors on that paper.
Mm-hmm.
In most cases, someone is, though.
Correct.
Any problem putting that in through the OSU system, since it has to get into My Bibliography of Dave's? Michael
was somewhat clear that if it's dealing anything with OSU or any of our authors here, they'll deal with it. The one issue that I would see is that the OSU open access policy will also be storing a copy of that manuscript. And I don't know if you submit it, they'll store it. And he hasn't stated that if people from Arizona, if you're collaborating with someone in Arizona or wherever, those publications would all be acceptable. I know that there's some people here that collaborate with people in China, and all the authors are in China. Yet those publications were cited. There is a way, let's just get to it. There is a way that you can add those. This is important. Each login route into NIHMS has its own account. So if you log in with ERA Commons, which I would suggest everyone do, this one, I would use the same login each time. You'll get confused. They said they can consolidate accounts for you if necessary. However, they're quite overloaded right now. This is what it looks like after a submitter deposits a file. I don't know if you can read that, I apologize, but let me explain what it is. This is the NIHMS system, and this is where you log in and you review and approve your submission. So this is the PDF report you can see highlighted in yellow up above. You look at it, check the box, and you certify that you opened it up and you read it, and it's all there. And you also have to make sure that your grant information is correct, that all the funding agencies are specified, and then you assign it to one of the authors. I've tried assigning it to someone that wasn't an author, and NIHMS kicked it back. So right now I'm pretty confident you have to be an author in order to do that. But this can all be done by a delegate, and this will all be done by OSU, by the library, if you choose to do that, go that route, or you can choose to do it yourself. Then this is what it looks like when you approve a submission. This is the statement. Here's the title. Here's the publication, and you confirm that, and you confirm the confidentiality. You confirm the copyright agreement. And then you hit agree, and they will process it and put it in PubMed Central. Actually, that was the initial upload. This one actually then is the PubMed Central, asking you to now review it with the original, and then the manuscript, PMC ready manuscript is highlighted. And of course, the funding. Make sure that these grant numbers are in there. You have to get your funding linked. What they're doing is building a web that they give so much money to this grant, and it produces this, and it produces this, and it produces this, and they're tied to these individuals. And it can get complicated, but it can also show that OSU has a tremendous impact. And we need to toot our horn and shout louder, and we can do it. But we need to stay on top of this, because we could outcompete universities by having everything in place up front to get this done without any delays. Again, we need to review this, that this is the only mechanism to release this funding. So now let's look more at the RPPR,
So
which is...
On this figure, where does the OSU library system? Right there. So if we send it to them,
They will take care of that.
So we have someone who will do that for us.
You have to do is say,
Those two times you have to step there.
Yeah.
Yeah, there's 2 acceptances that you have to do. Then you need to add it to My Bibliography, which we'll get into, I think, the next slide. Actually, we'll do the reporting first. My NCBI is a free account system. Basically, this is for their side. The one thing I wanted to show here, it's not updating. There we go. Yeah, this is the only way that you can enter publications into RPPR. This is important. We just have to stress that. So to sign into My NCBI, this is where you manage My Bibliography. This is where you manage your award letter. And you log in through the top. I would suggest that you use the NIH login. This is the same one that you would use for the NIHMS system. That is your login. You can also have a delegate in this system so that other people can help manage your files, but they can't do the approval. Don't give out your password, your ERA Commons password. Assign a delegate.
but they're asking us to do it. If we can't delegate someone on, we wish not to do that, then they're telling us to break. Because you know darn well we're going to do it.
I know, but I'm just telling you what I'm supposed to tell you.
Right, Sean?
So what accounts should be linked? If you have an ERA account and something that's been published, you will have a My NCBI account. It's automatically generated for you based on something being entered into PubMed. Now, this is the interesting part of how to get an award notice, how to look at your compliance list. You go into My NCBI, My Bibliography. Now, first, I'm hoping that you went in and checked to make sure if you have 43 pubs, you make sure that all 43 of them are in My NCBI in My Bibliography. Make sure all your pubs are there. You can't exclude them. Once they're there, click on Award. Make sure you do Public Access Compliance. Don't hit reverse, as I think the gentleman did with the next screenshot. And you want to group them by award, not by citation type. And what you will get is a report that looks like this. Now, this lists all your pubs and all your funding. I would ask all of you, please, generate this report. Make sure that the funding is listed that's there. If you put EHSC, we acknowledge EHSC for helping funding with this, and you have the grant number there, but it's not showing up here in this list, it's not linked. It's just in the document. You need to make sure that it gets linked. And I'll have a slide on that. These little icons tell you whether they're complete, which is their term for compliant, or whether they're not. And I have a full list of what those codes mean here. Very simple. Red means it's bad. Green means it's good. It works that way. Yellow means that it might be in process. Question marks are for articles, as we mentioned before, that maybe don't have any application to NIH. They weren't funded by the NIH, but yet they were cited within a report or cited within publications. It's something that's critical. It's something that needs to occur. They can still be added into PubMed Central, even though they're not in PubMed. This is how you set up a delegate in My NCBI. From the top, under your username, there is a menu, and you can click on it. It says Delegate. It brings up this box, and it says that you can add a delegate. You put in their name, their email, and give them access to what? My Bibliography or Science ENV. We won't get into what that is, but that's supposed to generate bio sketches for you automatically. Currently, it doesn't do a very good job.
Does the delegate need your password, your common password? No.
Create their own, or it might just be linked to their account. If they already have a My NCBI account and you would want to use their email address that's associated with their My NCBI account, and then it'll allow them to go in and review your award and do the other things for you that are necessary. They cannot accept publications. They can't do any of the acceptance processes that the NIHMS asks for. And they can't make big changes to your account, but they can add stuff to your My Bibliography and make sure your awards are compliant. So say you add a new citation to a bibliography. You know, it comes up initially that this question mark, what is it? This is where you can add funding. It gives you a place at the top. You can say yes, and you can start beginning the submission in NIHMS. Or you can say it doesn't need to be submitted because it was before 2008 and you're just adding it. It wasn't peer reviewed, but you need it in there. You want it in your My Bibliography. They're giving you this option to add things because what they're trying to do with the Science ENV account is create your bio sketches. And in order to do that, they need all this other metadata about you.
Do they also have the capability of showing how many times each one has been cited?
That I have seen, but I'm not sure.
Coming next?
I think Google Scholar is better at that.
And you think that might be compliance that they ask for later?
That's a good question, Dave.
Maybe,
Yeah,
right?
I'm not sure. So, and then if you want to add an award to something, this is how you can add an award to something that is already existing in PubMed Central. Not PubMed, PubMed Central. You have an award out there, you see it, but it's not linked to the appropriate funding. This is how you can add it later, even if you didn't acknowledge it in the paper. Make sure you use this. We found a lot of different publications that should be citing certain grants that didn't, or they acknowledged it inside the grant, and then when it got submitted, it was never acknowledged through the database. So please go in and check that and make sure that that is correct. What you will get if, the instance Robert was talking about, that Kim submits a paper and then Robert submits a paper, well, whoever submits it first and gets into the system, it links all the authors together and it says, hey, look, 2 new citations have been linked to your funding and added to your bibliography. Robert's got a T32 grant. 3 students published a paper. He knew it was coming, but all of a sudden now he has to acknowledge it in My Bibliography and add that. It's pretty much questions. Click on the button. It asks you, do you know these people? Is this relevant? And you say yes, and it's linked to you. And that brings us back to this nice graph that the manuscripts have to go in. They have to get into My Bibliography. And from there, your funding should flow. So this was an RPPR report that was drawn from my awards for, I think this is a real one, or it might be one that they had used as a sample. Anyway, you have your different pubs in the appropriate format and whether they're complete or non-compliant. And you just can't generate these reports anymore and have them say what you want them to say. And this is a My Award PDF that you will be attaching. This is the PDF that you attach with your progress reports from this point forward. You don't generate it in Word and Excel and print it as a PDF. You do it right offline. One way it's nice, if everything's already compliant, you can just click on it and you can associate it actually with grants. You can filter it and say, oh, I have, 3 PO1s in the past, a bunch of RO1s and a T32 grant. I just need to show the T32 grant information. You can filter that and it'll create a My Award that's just for that. So they have their tooting their horn of how they make it easier, and we'll skip most of this. I would like to then talk about preparation on how to avoid delays in funding. Do we have a plan that can withstand these different things? No, but I would like to ask that question. When are we going to develop one? And we have some resources at the library that will help us develop one. Also, a data management plan is starting to become a compliance issue, just to let people understand that that's on the horizon. And then we need to encourage everyone to go into My NCBI now and track this, get stuff in My Awards linked today, and do it well before the reports are due. I know there's 17 grants that we have from NIH from this university this year. All of them will require a progress report at some time. I don't know who I know who they all are, I can show, but we need to get it done today. And there's more resources here at public access at nih.gov.
After the embargo period, go back to Stacy's question, does NIH, NCBI, do they actually purge the crappy version with the actually copyright, or will that forevermore be the, well, 2 versions of this manuscript floating? That could really create confusions.
That is an excellent question, Robert, and I don't have an answer.
Because I'm sure the library could do that for it, but again, trying to us to remember a year later, to, oh, I better switch that paper.
Well, the library actually wants you to submit both versions, because at a point where you can have the publisher's PDF version out there, they will put that out.
Okay. So
Pardon?
How would they have to be triggered to do that, or would they know to do that?
Well, the NIHMS system actually has the triggers built into it. However, I don't know if the library does, and that's a question I'll bring up with Michael. So these are some more ways that we can ensure compliance. I would like to have more training that goes on. I don't know if I'm the right person to do this, or is there another role that needs to be doing this? However, it's a wide issue, and especially with seeing the NSF and the USDA coming on board with this, we need to get on top of this now. Well, the university just sent out a notice that they're looking for people to manage a director's office of compliance for the university. This is university-wide level. I hope that it's not all NCAA compliance and sports-related compliance. And they want someone who is a lawyer. They want someone that can deal with copyrights and can run these negotiations. That would be the person when they come in that we say, wait a minute, we have grant funding compliance that needs to be taken care of. How are you going to handle it? And I have a lot of ideas on that. I actually have a slide presentation that I put together that's kind of in a final draft state. Well, I think we really need to have some institutional compliance monitoring. I think the university has finally acknowledged that, so they are hiring a director for that position. Whether we'll see anything come out of that in the next year, I don't know. So what I'd like to ask all of you today, log into My NCBI. If you need help doing it, by all means, I don't want to say shoot me an email, but I can first go out, look on the web and see what you can find. And I will have this presentation. I guess Sharon will have a place that I can upload the PDF of it.
Can I share?
Well, please, yes. I want you to share it. The links at the back are important. And then ensure all your publications are listed in My Bibliography. If there's pubs that you know that you've done and you don't see them listed, well, if you got a proposal coming up, don't do them until after the proposal, because they will automatically be out of compliance if it wasn't done within 90 days.
So even if they were published before 2008?
No. Those are one of those NSF. They don't. That's not applicable to NAA. And then I want you to create a My Award list. I want you to not filter it for anything. I want you to look at all your pubs and see if they're compliant. They'll automatically check the date of the publication to see what it is. The unfortunate thing is if a publisher puts it in there and they haven't submitted that peer-reviewed manuscript to NIHMS, it will be out of compliance if it's not done within 3 months. So I'm demanding or requesting to submit all publications, including those from journals identified using methods A and B, to the library, because we don't.
And your pen.
Pardon?
Where they do it for us, the journal.
Okay, yeah, but I mean,
We can't count on it.
Okay.
You can't count on it. The unfortunate thing is this is a silo. Coming from a enterprise resource and planning background, this is a silo of data, and they're trying to build a database that houses all your personal information and does everything for you. But then you're going to have another one for NSF, and then you have ResearchGate, and then other people might use digital measures, or how are we going to combine all this data into a single place, and how are we going to utilize it? Those are all topics for more conversations. But please use this link, submit your publications. There will be a web submission form is currently being developed to further simplify this process, and it will be linked directly with the library. We're working together on that. It says questions and then the appendix. So does anyone have any questions? Thank you.
Thank you.